So in the previous topic, we talked about the pathophysiology of the different stages of syphilis. So now we're going to talk about the clinical features of those stages and how they present in a patient. So guys, let's talk about the clinical features now. And first, let's talk about primary syphilis. Primary syphilis appears 10 to 90 days after exposure to the infection, and it comprises a painless, indurated ulcer, which is also known as a canker, and it forms at the site of inoculation with the Treponema Pallidum. Now, HIV patients usually develop multiple cankers. It is very important to note that these lesions resolve without treatment in about 3 to 6 weeks. They are accompanied by regional lymphadenopathy, and this consists of rubbery lymph nodes. So if you're examining a patient, do look out for these nodes. Now, let's go on to secondary syphilis and how it presents in patients. Secondary syphilis appears 2 to 8 weeks after the disappearance of the canker, and it has multiple systemic manifestations that can involve any system and any body part. These include a maculopapular rash, which involves the palm and soles, condyloma lata, which are smooth, painless, wart-like white lesions on the genitals. We may see generalized lymphadenopathy. We can see alopecia, which is basically patchy hair loss. The patient can suffer from a headache. They can suffer from myalgias, which are pain in muscles. They can suffer from arthralgias, which are pain in joints. And they can also complain of pharyngitis, which is sore throat. They can also complain of malaise, that is a general feeling of ill health. And you can also see hepatosplenomegaly, which is enlargement of the liver and the spleen. As the cutaneous manifestations contain a high load of spirochetes, it's imperative to remember that these lesions are highly contagious. Now, as mentioned before, untreated primary or secondary syphilis is followed by an early latent phase, that is 1 year or less, or a late latent phase, that is 1 year or more. And these latent phases are characterized by positive serological tests but negative clinical manifestations, meaning the patient will not have any symptoms, but if performed, the serological test will come out positive. So guys, let's now talk about tertiary syphilis, the dangerous looking tertiary syphilis. Well, tertiary syphilis is late symptomatic syphilis, and it can manifest months and even years after the initial infection. Now, they can manifest as cardiovascular syphilis, neurosyphilis, and gummatous syphilis. Now let's go into a bit detail about these three types. Let's talk about each of these in a little detail now. First off is cardiovascular syphilis, and this may include an aortic aneurysm, which is an abnormal bulge that occurs in the wall of aorta. It can be aortic valvulopathy, which is an aortic valve disease that occurs when your aorta and left ventricle malfunction. Now, moving on, let's talk about neurosyphilis. And neurosyphilis may include meningitis, which is inflammation of the membranous coverings called meninges of the brain and spinal cord. We can see patients suffering from stroke. They can suffer from hemiplegia, which is a condition caused by brain damage or spinal cord injury, and it leads to paralysis on one side of the body. Patients can suffer from aphasia, which is a language impairment, and it can cause problems in the production as well as comprehension of speech. Now, patients can also suffer from seizures. They can suffer from a disease called tabes dorsalis. Now, tabes dorsalis may be a bit difficult to comprehend, but it's basically an injury of the dorsal column of the spinal cord. And we can also see patients suffering from a disease called Argyll-Robertson pupil, in which the pupil does constrict with accommodation, but it is not reactive to light. And doctors also call it sometimes prostitute's pupil. And the last sign which we'll see is a positive Romberg sign. Now guys, what is gummatous syphilis? To put it in simple words, gummatous syphilis is an infiltration of any organ and its subsequent destruction. So we're not going to go into much detail about it, and we're going to keep it as simple as possible. Now moving on, let's talk about congenital syphilis. Congenital syphilis results from the transplacental transmission or contact with the infected lesions during birth, and it can be acquired at any stage, causing stillbirth as well as neonatal congenital infection. Now, bone changes seen are due to the inflammation and disruption of the osteochondral junction in the long bones, and on occasion, bone resorption and fibrosis of the flat bones of the skull can also be seen. Examination of the placenta reveals proliferative and arthritis of fetal vessels, which is in essence inflammation of the inner lining of an artery. Now you will also see a mononuclear inflammatory reaction as well as villus immaturity. Now, many of the neonates born with congenital syphilis are asymptomatic at birth, meaning that they do not present with any signs and symptoms. However, early signs can manifest up to 48 months as rash, hepatosplenomegaly, fever, bulging fontanelles, which occurs when fluid builds up in the brain or the brain swells, and it leads to increased pressure inside the skull. They can also present with seizures as well as cranial nerve palsies, which is characterized by a decreased or complete loss of function of one or more cranial nerves. Those untreated neonates enter a latent period. Now, there are many presentations of congenital syphilis, and it includes, number one, the patient can present with a saddle nose, which is basically nasal cartilage destruction. Number two, an Olympian brow, which is frontal bossing. Number three, they can present with saber shins, which is bowing of the tibia, which is a bone in the leg. Number four, they can present with something called as sniffles, which is basically rhinitis. They can present with a morbilliform rash. They can present with something known as Clutton joints, which is in essence sterile joint effusion. And the last but not the least, they can present with something known as Hutchinson teeth, which are peg-shaped upper central incisors. Now, it's a bit difficult to remember all these names, and these manifestations are also very rare, but they need to be remembered because they are the classic manifestations of congenital syphilis. In order to prevent such a dire condition like congenital syphilis from happening, routine screening is recommended at the first prenatal visit and during the third trimester, as well as delivery in high-risk women.